Radio Health Journal. I'm Nancy Benson. This week, ultraviolet light and eyesight.
The UV rays cause damage to tissues, and we've heard about how sun damages skin and the importance of sunscreen. The eye is no different.
Preserving eyesight during the summer when Radio Health Journal returns.
I'm Reed Pence, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
Fear of the other makes us un-American. It makes us do things that decades later we look back at and we scratch our head and we say, how in the world could we have done that?
The lessons to be learned from America's ugly Japanese internment camps. Then,
tips for traveling the world and exploring new cultures.
these stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes, and Stitcher.
Summertime means the sun is out and people are eager to soak up some rays, but ultraviolet rays may pose some dangers to our eyesight.
The UV light causes damage to the surface structures of the eye, the delicate tissue, the conjunctiva, and also causes damage to the internal structures. So blocking UV radiation is very important.
That's Dr. Rachel Bishop, an ophthalmologist at the National Eye Institute. She says sun eye damage is easily preventable, yet it's so easy to forget. Fortunately, sunglasses don't have to break the bank, but they do need to have UV protection.
Happily, sunglasses are required to do this, and if you're shopping for sunglasses, you really don't have to spend a lot of money. You just need to look for that tag that says blocks 99% of UVA and UVB light, and those don't have to be expensive.
UV protection needs to be for both UVA and UVB rays. That's worth noting because some sunglasses will protect only one or the other. Some contact lenses and eyeglasses provide UV protection as well, but Bishop says they should not be used as a substitute for sunglasses.
Eyeglasses will have a UV protection in the manufacturing stages, which you should, of course, confirm when you get the glasses. Contacts do as well, which, again, you should confirm. Contact lenses, of course, pose their own risks because the contacts sit directly on the eye surface. They offer the possibility of infection. So it's really important for people who wear contact lenses to follow the instructions on how to clean them and maintain them, and, of course, to wash their hands before they're handling their contacts. A lot of young people wear contacts and might become a little relaxed about using them. Unfortunately, it poses the risk of infections, which can cause vision loss.
While many eye structures, such as the macula and retina, are prone to damage from UV rays, Bishop emphasizes the importance of protecting the lens. The lens must be clear for the retina to receive a sharp image.
We've heard of cataracts, which is changes in the lens, and that happens naturally, actually, with aging. But UV light also affects the lens and hastens cataracts. You may also have noticed, particularly in older people, that they sometimes have this thickening on the whites of their eyes, particularly if they've spent a lot of time in the sun or live in the south. And this is UV sun damage that can be quite irritating. It makes the eyes feel dry. It makes them feel like they have pebbles or sand in the eye. It's quite a nuisance, causes a lot of discomfort. And this is all preventable by blocking UV radiation with sunglasses, broad-rimmed hats, things like that.
People with light-colored eyes like blue or green eyes are at a higher risk for sun eye damage than those with dark eyes. But Bishop says that doesn't exempt dark-eyed people from being concerned about risk.
Just like the pigment on the skin varies and the purpose is to absorb the light energy and protect the skin, the pigment in the eye serves the same purpose. Unfortunately, though, truly everybody is at risk for eye diseases.
Now, you may think there's no need for sunglasses on a cloudy day, but Bishop says that's far from the truth.
UV rays can penetrate through a lot of what the atmosphere puts up there. In the summertime, if it's bright and if the sun is out, even if it's a little cloudy, it's a good idea to be wearing sunglasses.
So now you might be thinking, I better just stay inside. But research suggests that can be just as bad. A study in the journal JAMA Ophthalmology finds that exposure to more UV light in childhood and adolescence can lead to reduced myopia or nearsightedness. A lot of parents say less screen time also helps in that regard. Screen time certainly strains the eyes, but Bishop says sitting at a computer doesn't necessarily produce more nearsightedness.
The National Eye Institute actually has invested a lot in research on myopia or nearsightedness, and there's a lot that's still unknown. Some of the theories that outdoor light and time is healthy to prevent myopia development, and that too much time reading and near work might make nearsightedness, myopia worse. There is suggestion of these relationships, but honestly, we need to resolve some of these questions with the ongoing research that's happening now.
So while experts suggest there is such a thing as a healthy dose of outdoor light, Bishop takes this idea a step further. She says getting outside has other health benefits unrelated to UV light exposure.
The idea of getting outside has to do also with where you're focusing. So there are a lot of things Americans can do to protect their eyes. They should eat a healthy diet. They should get exercise. They should be on top of all their medical problems, control their weight. These kinds of things all contribute to keeping the eyes healthy as well. It's very important also to know their family history, because a lot of eye diseases that are treatable and vision loss is preventable, these diseases travel in families. So if you have a parent or a sibling with glaucoma, for example, you're at higher risk yourself.
Knowing your family's health history helps your doctor identify and treat eye diseases, many of which are easily treatable. But what about eye conditions such as macular degeneration? The American Macular Degeneration Foundation considers this disease, the leading cause of vision loss, as incurable. But even so, Bishop says treatment for macular degeneration has greatly improved.
Macular degeneration is a disease that needs close monitoring and care with the eye doctor. There's a lot we can do to help with macular degeneration, and the treatments have been revolutionized in these past 10 to 15 years. It's a much better story than it was in the past. The real important message would be getting an eye exam, because there are ways to monitor for this at home and with your eye doctors and exams that will treat changes when they happen and preserve vision.
Bishop says if you've never had an eye exam, get one. Detecting early signs of eye disease is the first step to preventing severe complications down the road.
More than 23 million adults have never had an eye exam, wouldn't necessarily know that they could have an eye disease, an eye condition, which could be causing damage and eventually lead to vision loss. The only way they would know that is by having an eye exam.
The relationship between UV light and eyesight still has many unanswered questions. But one thing is sure, taking simple preemptive measures can preserve your eyesight. So Bishop says get an eye exam, know your family history, and don't forget your sunglasses. Our writer this week is Hannah Swarm. Our production director is Sean Waldron. I'm Nancy Benson.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.